The BC NDP government today announced it is fast-tracking a new medical school in Surrey as the province continues to struggle with emergency room closures and the ongoing effects of a doctor shortage. For more, let's check in with Rob Shaw at the BC Legislature tonight. Rob, there's a bit of a good news, bad news aspect to this story. Tell us more about that.
Well, that's right, Stacey. You know, on the North Island, people very familiar with ER closures due to doctor shortages. The NDP government offering up at least one solution here today to train more doctors, but getting criticized at the same time for at least 4 ER closures in the interior and the north over the past weekend. The new medical school proposed set to open at SFU's existing campus in 2026, increasing the number of doctor spaces by 39%. It's the first new med school in BC in more than 50 years, as most governments in the past have just focused on expanding the UBC med school. Here's the Premier today.
We're training a new generation of doctors here in British Columbia. We're preparing for the future. We're making sure that we're meeting the needs and expectations of British Columbians in their healthcare system. And despite the challenges that we face, we can see that we're turning the corner on these important issues. I've never been more optimistic about where we're headed.
But those classes of up to 120 new doctors won't start graduating until at least 2029, almost 10 years after the NDP first promised a new med school. The crisis persisting right now with at least 21 ER closures since July 1st due to nurse and doctor shortages. 4 in the interior this past weekend, including in Merritt, where temperatures are exceeding 40 degrees. There's a big music festival coming up this weekend, and there's also a failure in the local water system, setting up the potential for some serious rural healthcare problems.
You know, when you have an ER closure in a rural community, you're not going down the block to another facility. You could be in the position of having to drive literally hundreds of kilometers to the next medical facility. That simply shouldn't happen in British Columbia, and we continue to see it.
It is true, and in a number of cases over the past weekend, we had what we call relatively late sick calls, and so such province-wide systems can't respond in remote communities when there's a late sick call. And that's not a criticism of anyone for calling in sick. When you're sick, you're supposed to call in sick, but it just creates real challenges in the system.
All of this part of a larger election conversation on healthcare. The BC United and Conservative parties continuing to propose eliminating the mandatory vaccination requirement for healthcare workers, which would help rural British Columbia, especially. The health minister today again ruling that out. Stacey, both parties want more private healthcare involvement. The Greens want more community healthcare centers. Expect a lot of this discussion, but no easy short-term solutions as we get closer to the election. Stacey.
Yeah, healthcare, one of the big issues we'll be hearing a lot about as we head into October. Thanks so much, Rob.